Omidvar.
Thank you, Chair, and thank you to all three of you for being with us today and for all the wonderful work you do for Canadians and global citizens. My question is likely to Mr. Moyer because he represents Cooperation Canada, which has a large membership. I wonder, Mr. Moyers, if you can tell me whether your colleagues in the international development field in the US, UK, Australia are pooling their efforts to bring more reach, efficiency, and impact in these COVID efforts, and whether your members are part of these pooled efforts.
Well, there are diverse responses to that. I mean, the global COVID response is very, very broad. I think what we've seen in Canada a launch of a consolidated appeal for fundraising by the Humanitarian Coalition. So multiple agencies, of which two are here on this call, have put their efforts together to fundraise, to mobilize funds. In terms of pooled responses, I'm afraid I can't actually draw on specific examples with the COVID response. And it may be that my colleagues can through their global program partnerships.
I can do that. I'll just give.
Please go ahead.
Okay. Yeah. Thank you, Senator, and thank you, Senator Omidvar, for all that you do to support our work, and thank you for this question. I'll maybe just give a couple of examples as part of an international confederation like Oxfam. We work with our fellow members across the confederation, and CARE has presence in about 100 countries around the world. So as just one example, over the last, 6 to 8 weeks, we've mounted a very present and sustained response in India specifically, and many, many parts of the Confederation from the UK, the US, from Canada, from across Europe and from Australia and so on, have really come together in a very singular way to support our colleagues in India. And now we're turning our attention to Nepal, to Bangladesh, to some of the other contexts nearby to India where numbers are continuing to be very, very troublesome. Those are very, I think, important efforts. Those are less visible, quite frankly, within the world context. I don't think the degree to which the civil society sector uses its global reach, frankly, to have very, very high impact is always seen from a country-specific context like here in Canada. But I can certainly say that from a CARE Canada perspective, it's been very robust.
Thank you. Do I have time for a follow-up?
Have to be a very quick one, Senator.
Quick one. Then let me ask Ms. Byrnes. Can you comment on the legislative and regulatory barriers in Canada that prevent international development charities from being effective on the ground?
Sure, I'll do that quickly. And I thank you for the work you've done on this, Senator Omidvar. So we were talking about pooled funds. You mentioned pooled funds. So pooled funds are a very effective way in a country of trying to put all the funds coming in together for a humanitarian response and then dispersing it based on need. So where the need is most, so reaching the most vulnerable. One of the challenges we have with that is the law that around direction and control and own activities that's in the income tax law, which is quite antiquated and says that we actually, everything we do with the money we receive from the public, we have to use it for our own activities, which is quite challenging when we're relying on local organizations who know the context, who are well implanted in their context, or even our other Oxfams who are well implanted are not considered qualified donees by the government. So we have to do a lot of administrative contracts and burden and all sorts of paper trail to meet those requirements. So it does create a lot of...
Thank you, Madam Byrnes. The time is up on that one. I should note it's an important subject. Senator Omidvar knows it well. She has a bill before the Senate.